And AgriTalk coming your way this morning at 9:06 on KNEB. 7:52, time for News Extra, and today brought to you by Pinnacle Bank, Mitchell and Torrington. The way banking should be. Here's Kevin.
Thank you very much, Dennis. Good morning, everyone. We're really pleased to have Caryn Long here today. She is the regional representative for Nebraska's Senior Health Insurance Information Program, and that's a program conducted under the auspices of Nebraska Health Insurance, or Nebraska Department of Insurance.
Department of Insurance,
right.
Yes.
Okay. So anyway, after I get through with all that stuff, she is going to hold a workshop on Medicare. It's coming up March 7th. That would be Tuesday night, 6 p.m. over at the Harms Center. And you, if you're looking at going on Medicare and all that stuff, you probably need to go to this workshop.
Yes.
Right?
Yes, it's a good idea.
All right. And people should register ahead of time?
We would like people to register so I know how many handouts to bring and, of course, how many cookies to order.
All right. 635-3606 is the number up at the Harms Center. Pretty easy number to remember. 635-3606. We'll repeat it again here toward the end. So let's just go down here real quick what are the big questions about Medicare? Number one, should I enroll if I'm still working and maybe have employer coverage?
Right. Employer coverage isn't comprehensive anymore like it used to be because people are paying higher premiums and higher deductibles. Now people really need to sit down with a pen and paper and decide which will be most cost effective for me, my employer coverage or Medicare. Medicare has premiums, copays, and deductibles just like your insurance, so it's good to put pen to paper.
How soon do you need to do this before you turn 65?
It's a good idea to at least give yourself 6 months to research your options, but I really welcome people who are a couple years out from Medicare age to start learning about Medicare so they're not surprised when it's time to enroll.
Okay. All right. So who should not delay this?
People who should not delay Medicare are people who do not have current coverage through their employer. If they don't enroll when they're first eligible, there are penalties for late enrollment for Medicare Part A and B. So if you don't take it when you're first eligible and you want it later, you're going to find out it's going to be more expensive.
So if you're looking at being eligible, then you better get with it, right?
Right. People who, and we didn't talk about this earlier, but people who are drawing their Social Security check are automatically enrolled in Medicare, so there's nothing that they have to do. Yeah. But if you're not drawing your Social Security check, you have to enroll yourself into Medicare.
Yeah, okay. All right, very good. So let's go through all the ABCDs of Medicare here real quick. A and B, what do they cover?
Medicare Part A covers hospital, skilled nursing facility care, home health, and hospice. With no premium.
No premium, right?
Correct.
Okay, so that's good.
Part B covers outpatient care, doctor visits, and durable medical equipment for a premium of $134 a month in 2017.
All right, very good.
Both have deductibles and copays, which leads us into supplement insurance. Most times people that have supplement insurance aren't aware of the deductibles and copays. Because those supplements are paying the deductibles and copays for them.
Okay. So it just all depends on whether you can afford the deductibles and copays, right?
Right.
Whether you get supplemental insurance.
And a word of note about Medicare has no cap on what you would owe. So that's why people pick up supplement insurance to pay, one catastrophic event could be financial ruin.
All right. So supplemental insurance is probably needed in most cases.
If you can afford it, yes.
Yeah. Okay. All right, we'll be back with more right after this.
Secure your peace of mind with Pinnacle Bank's new checking account, the Diamond Secure account. With it, you'll get all the great features of our checking accounts, along with identity theft protection and cellular telephone protection. For complete details of this checking account, speak with the bank representative. Open a new Diamond Secure account in branch or at wypinbank.com. To switch your current checking account, visit your local branch in Mitchell or Torrington. Pinnacle Bank, member FDIC. Insurance products are not insured by FDIC or any federal government agency. Not a deposit of or guaranteed by the bank or any bank affiliate.
All right, we're with Caryn Long from the Nebraska Department of Insurance. She's the regional representative for the senior health insurance program here in our area. We're talking about Medicare and a workshop that's coming up March 7th. That's this coming Tuesday at the Harms Center, 6 p.m. And if you're coming up on eligibility for Medicare, you really need to go to this workshop. You should register by calling the Harms Center at 635-3606. We're kind of going down the list here on Medicare. We've covered A and B. Now, what about Part C?
Medicare Part C is called Medicare Advantage plans. Here in western Nebraska, we only have one company that sells us a Medicare Advantage plan. On television, they are showing some other Medicare Advantage plans that are not available here. They're only available in urban Nebraska. We have one company. These plans are popular for people who are on Medicare due to disability who are not the age 65 yet. Because in the state of Nebraska, unfortunately, Medicare supplement insurance is not available to them yet.
Okay.
So that at least gives them some coverage with a cap of how much they would owe every year.
All right. And it's not available in like 4 counties, right?
Right. Dual, Garden, Kimball, and Sioux counties do not have Medicare Advantage plans available to them.
All right. Real quick, we only got a minute left. Part D is the drug part, right?
Medicare Part D is the drug coverage, which is optional. But if you don't enroll in Part D when you're first eligible, there are penalties for late enrollment. And that's all Part D is for prescription drug coverage that you take at home.
Yeah, what about the donut hole thing?
Oh, donut hole is shrinking.
Good.
That's part of the Affordable Care Act, that the donut hole will be gone in 2020. Unfortunately, drug prices are rising, so that's another conversation for another day.
Well, somebody says he's going to do something about that.
Yeah, I certainly hope so.
I'm not going to mention his name, but somebody says
I
he's
certainly
going to do
hope
something
so.
All right. All right, very good. Once again, if you want to register for that workshop, get it done. 635-3606. It's this Tuesday night, starting at 6 p.m. over at the Harms Center. Thanks, Caryn.
Thank you, Kevin.
You bet.